For kids who had encephalitis or ADEM, what is their long-term seizure risk? Do they eventually outgrow them, or is it a lifelong concern?
Great question. So I think when we look at seizures and subsequently epilepsy in individuals who've had MOGAD, we kind of see that there's this biphasic pattern. There's seizures at presentation, which do tend to be a little bit higher in prevalence in children. And then we actually see seizures later on once the immunotherapy has actually, if there is a relapsing course, has had an effect. But we've observed several patients who have now gone on to have epilepsy at a unexpected rate later on. When we image some of these patients, we do find some of the classic findings that we'll see in individuals who have epilepsy. So thinning of the temporal or the medial temporal lobe, or the hippocampus is another part of the brain that we see that. The question I think that has come up is this sequelae of the initial attack? Because usually these patients will have seizures at presentation and have seizures subsequently. Or is this indicative of active inflammation? When we have done more of the aggressive workup in that latter group, we have not found active inflammation, even when patients are having, children are having the continued seropositivity of the MOG titers. So the short answer is we don't know, but up front we see that immunotherapy definitely cleans up the seizure activity and reduces that, but this long-term epilepsy risk is difficult. And we have seen a higher number of individuals who have had these kind of dual antibodies come up, where the phenotype is certainly more consistent with MOG, but there are these other antibodies at low levels associated typically with autoimmune encephalitis, even though that phenotype is not present.